My name is James Elson. Over the next few minutes, I'll be giving you a speech on why you should choose a home birth over a hospital birth. In fact, I guarantee to have you convinced by the end of my speech. To start things off, Ole Olsen, a researcher from the University of Copenhagen, recently examined several studies of planned home birth with a hospital backup versus a planned hospital birth. He studied a total of 25,000 births from 5 different countries, and in the end, there was no real difference in the mortality rate. Both studies had no deaths involved, but there were some pretty significant differences, and I'll go over them now. One, there's fewer medical interventions in the home birth group. Follow that with fewer homeborn babies had illnesses. They were a lot healthier, which is always a good thing when you're having a baby. You don't want to have a sick baby. And also, the home birth mothers were less likely to have suffered lacerations during birth. Couple this with labors not being induced or being altered or influenced by medications. And also, there was fewer C-sections, forceps or vacuum extractor deliveries as well. And as I said before, there were no maternal deaths in either group. I know a lot of my information, I got a lot of it from the internet, and also my wife is a doula and a home birth educator. Although giving birth in a hospital seems like the safe way to go about having your birth, what people don't realize is that a hospital can be very risky towards the health of the mother and the baby. Hospitals care for the sick, which means there are all sorts of viruses and bacteria floating around. In this speech, I'll present with you facts and real cases covering the following: the benefits of home births, the dangers of a hospital birth, and things you should know before making your decision. Home births can be very beneficial. Home births provide many benefits beyond a safer birth. Some families choose home birth because they believe their home is the most appropriate place to bring in their newborn child. Some families choose home birth because they want control over all the circumstances of the birth, including who is present and who is there to support the mother during the birth. Mom's nurturing boosts baby's brain. Maternal nurturing is vital to the development of baby's brains. Home birth fosters unmedicated births to both mom and baby. The bonding hormones, or endorphins, that are administered because this helps support continuous contact between mother and newborn, thereby facilitating breastfeeding and all aspects of maternal nurturing. At the hospital, you are on their terms, but at home, everyone is in your domain. You are in control and make all of the choices, from who is invited to where and how you wish to labor. You can eat or drink as you please, and there's no need to worry about the pressure of unnecessary interventions and hospital procedures. On the flip side, hospitals can be dangerous. Nearly every woman giving birth at a hospital will receive a drug at some point during her stay. Pitocin is frequently used to induce or augment labor because it causes abnormally strong contractions. Many women receive a pain-relieving drug such as a narcotic. Unfortunately, narcotics also are received by the baby and can affect the condition of the baby at birth and for years after. Some of these side effects are respiratory problems, impaired muscular, visual, and neural development in the first week of life and in the following years. Also, these can lead to lower reading and spelling scores, difficulty in solving problems, and performing tasks when they pose a challenge. Along with the lithotomy position comes immobility. It is impossible to move around when you are on your back. It's even more difficult if you have internal and external fetal monitors attached to your body. An IV running into your arm, and after a narcotic drug was given to you to take off the edge of the birth. It goes without saying that if you had an epidural, you're not going to be doing a whole lot which hurts your process of giving birth. All this being said, I'm just giving you the information. In the end, it's always your decision. But these are some things I want you to think about before making a decision. You are in control of your body. Although hospitals try to make you feel like you have no choices, remember, it is your body. You can always say no. If they want us to give you epidural, medicine, C-section, remember, you have the option to say no. Also, make sure you choose a doctor or a midwife. When you do it, make sure you do a thorough interview with them and check on stuff like their medical background. And with doctors, ask them what their cesarean rate is. These are very important factors. Some doctors will have a higher cesarean rate. If you're not wanting to have a cesarean, or as what people know as C-section, you need to make sure that you check these rates, because some doctors, first small little window of danger, will force you into a C-section. As you can see, the benefits of home birth definitely outweigh the dangers of hospital birth. Over this speech, I covered the benefits, the risk, and I covered a couple of things you should know before making your decision. With such overwhelming facts pointing to the favor of a home birth, I ask you that you inform your friends and family of what you learned today. People need to know that they have options when it comes to birth, and that hospitals are not always the way to go.